Yes, Yi Lin from Mayo Clinic in Rochester, Minnesota. And thank you very much for having me. This immune effector cell, or IEC-associated enterocolitis, is a fairly recent term. Over the last year, as we recognize more patients are being treated with CAR T, that they could have diarrhea that are more frequent than just what they may see, for example, with lenalidomide or some of the other medications that they've had before. And the onset of that typically on average is about 2 months after CAR T infusion, with this being most commonly in that first 6 months. And so what's important to recognize with this is, first, of course, to rule out infections, GI infections, which can also present in the same way. But once those are treated, if the patient do have that persistent diarrhea, this is most likely related to the immunologic changes in the gut after the CAR T treatment. And so it's important to connect with the CAR T treatment center to go through the appropriate evaluations and try the managements to try to improve the symptoms. Once we started to recognize this enterocolitis, which was actually initially recognized in the real-world populations for patients receiving FDA-approved CAR T, and it wasn't that common. It was about 2% of the patients who received CAR T in the real-world population. So Janssen went back and looked at all the registration and clinical trials with Cilta-Cel, and that was about 483 patients treated across CARTITUDE-1, which was the first single-arm registration study, CARTITUDE-4, which is the randomized control study in earlier line setting, as well as CARTIFAN, which is the study that was done in China. So this is quite a high number of patients, close to 500 patients treated on a clinical trial. And among all of those patients, the incidence of the enterocolitis was about 1.2%. So overall, this is not a common phenomenon. It's somewhere in that 1 to 2% of the patient population. But because the diarrhea can be severe, sometimes requiring patients to be managed in the hospital for electrolytes and nutrition, we want to raise awareness that patients and families, as well as the hematologists who be managing the patients, at a time point when the patients will be going back home, to be vigilant to watch out for this, that if patients are having the more severe diarrhea, that they're being evaluated for this. Now, on the trials, among the 1.2% or 6 cases that we're seeing among the 483 patients, their presentations were overall generally milder than what we saw in the real world, and all of their symptoms resolved with supportive care, IVIG, steroids management. We're really trying to understand what is driving the severe diarrhea. We know timing-wise this is happening after CAR T infusion, but trying to get into the biological phenomenons so that if patients do have the more severe presentation, like we are seeing with some of the real world, beyond the standard supportive care management, are there other things that could be considered? And so far, among the cases that were identified in these clinical trials, what we can see is that the normal plasma cells that would normally be in the GI tract are completely depleted after CAR T therapy. This is in some ways not surprising. This is just showing how effective CAR T really is. It's going to all places in the body and getting rid of the plasma cell that has these BCMA expressions. But for those patients who had the enterocolitis or diarrhea, these particular patients has more of a persistence of the CAR T cells in the bloodstream, including month 1 to month 3 post-infusion, when we generally expect that CAR T population to start to die down. In addition, the IgA, the immunoglobulin that's more associated with the gut mucosa, are really depleted and stay depleted for a much longer duration in these patients who had the enterocolitis compared to those who didn't. So we're getting to understand a little bit of, what are we finding biologically in these patients. At this time, we're not necessarily identifying something very specific to know that, we can have 1 or 2 very specific treatments that could make this go away or improve. So we're continuing to learn from these cases that we're seeing and collectively the experience of what is working for these patients. And so one of the things, as a CAR T treatment center that we tell all patients and the home hematologist oncologist is that this is something to watch out for. And if they do see this, of course, they need to check for infection, manage for infection, but to also connect back with the CAR T treatment center as we may be learning, in real time, some additional testings and management that we could be offering for these patients. At the very high level, what's important for people to recognize is that Cilta-Cel CAR T is a very effective treatment for patients with multiple myeloma. In the randomized control study, we have seen that this has offered an overall survival advantage, not just a progression-free survival advantage and response. And that is even in the context of recognizing that, you have these uncommon side effects such as the enterocolitis. So we don't want to take away that main message that, patients who are otherwise medically fit for CAR T really should be evaluated and considered for CAR T in the earliest possible indication. Something that probably can help reduce even further some of these uncommon but could be severe side effects include, identifying early progression, so patients are being managed to take into CAR T treatment when their myeloma disease burden is still lower, because that's one thing that could drive increased CAR T expansion and some of these associated side effects. So working closely with CAR T treatment center to try to get patients into evaluation and treatment in the earliest possible setting while the CAR T is being manufactured, bridging treatment to try to reduce disease burden. We think in general these can help with some of these late side effects. Once the patient has been treated, keeping a close eye on that lymphocyte expansion or persistence, as those often do correspond to that CAR T expansion as well, just to recognize that patients who may have still that persistent higher lymphocyte count may be at higher risk for this. And then really it's education. It's not waiting too long. Sometimes diarrhea can be from a lot of different things. So people might think, well, is it something I ate? Is it, it's always to err on the side of caution, never too early. We don't mind being questioned to say, hey, I'm having diarrhea. Could this possibly be related, knowing that I had CAR T treatment in the recent months? It never hurts to get the testing started early. I mean, certainly if we identify there's a clear infection, we can get the management started. If we don't find infection, now we're going down the path of, could this really be related, timing-wise, given the patient has had CAR T recently, so that the hematologist can start with the broader testings to see what is happening in the GI tract, including things like EGD, colonoscopies, to really take a closer look at the gut.